Hi, my name is Nicole. I'm going to be your nurse today. Can I have your name and date of birth, please?
Valley Law, 12/16/99.
Thank you. And what brings you in today?
I have a headache.
Can you tell me a little bit more about that? Like what it feels like? Is it like a dull headache? Does it feel more throbbing?
It's throbbing, and then I get sharp shoots of pain, sometimes that make it hard to focus.
Okay, when did this start?
2 days ago.
And has it been like the same level of pain since, or has it gotten worse? Has it gotten better?
It's gotten worse since yesterday.
Do you notice it hurting more in a certain area in your head?
Like up near my temples and my eyeballs.
Okay, and if you had to rate your pain on a scale of 0 to 10, what would it be?
7.
And do you notice any patterns with the pain? Does like a certain activity or factor make it worse?
Just walking around, especially up and down the stairs.
Okay, and is there anything that makes it better?
Laying down in like a dark room.
So do you think light makes it worse then?
Yeah, definitely.
Have you been taking any prescription or over-the-counter medications to try to alleviate the pain?
Ibuprofen.
Has that been helping?
A little bit.
Do you remember how much you took?
Maximum dose allowed, I think it was like 3 times a day. I took 2 tablets, and they're 200 milligrams each.
Okay. And was that yesterday or today?
Yeah, I've only taken 2 today, but yesterday I took all 3 rounds.
And were you doing like an activity that you can remember when the pain started, or did you just kind of wake up with it?
It was after I went on a run outside. It was really cold out that day.
I just want to ask you a few more questions to evaluate your neuro state. Have you been experiencing any lightheadedness, dizziness, or problems with balance or coordination?
Nope.
Have you been experiencing any ringing in ears or changes in vision?
Nope.
Any difficulty swallowing? Any difficulty communicating with others or understanding what others are saying to you?
No.
Any changes in bowel or bladder function? Do you currently or have you previously smoked cigars or cigarettes?
Nope.
And have you been experiencing any memory loss or muscle tremors?
No.
Okay, thank you. And that's all the subjective info I'm going to ask from you. So now is normally when I would take your vital signs. But first I want to assess your level of consciousness. So can you tell me your name again?
Allie.
Do you know what time it is?
It's the morning, around 8 a.m.
Do you know where we're at?
The clinic.
And do you know why we're here?
Because I have a headache.
Perfect, thank you. Now I want to begin my eye assessment. So I'm going to perform my hand hygiene first. First I want to test your extraocular eye muscles, so you can keep your head facing towards me and just follow my finger with your eyes. Okay, and then follow my fingers and bring it closer and away from your face. Now I want to test your pupillary constriction, so you can continue looking straight ahead as I shine this light across your eyes. Perfect, thank you. And your extraocular eye muscles are intact. Your pupils are equal, round, reactive to light accommodation. Now I'm going to assess your mouth, so if you can open up and stick your tongue out. Thank you. Color is pink and it appears moist. I'm going to start my skin assessment, so if you want to just kind of put your arms out for me. I just want to assess for your skin color first to make sure you have even pigmentation. Upper extremities look good, maintains a palish pinkish color all throughout. Same with lower extremities. Now I want to assess for moisture. Your skin is dry. Now I just want to assess for temperature. Okay, good. Upper and lower extremities are bilaterally dry and warm, even pigmentation. Now I want to begin an assessment on your nails. So first I just want to assess the color of your nail beds. And they all appear nice pink undertone. And now I want to assess your capillary refill. So I'm just going to apply light pressure on all your nails. Okay, upper extremities are intact. Nail beds are pink. Cap refill is less than 2 seconds, which is in regular range. Then I want to palpate your carotid. Okay. Perfect. Even strength and tone, and I'm also going to auscultate that one. Even in strength and tone, and there were no bruise noted. Then I'm going to listen to your 5 heart sounds. I'm going to start with your aortic, which is in the second intercostal space on the right sternal border. Then I'm going to move to your pulmonic, which is in the second intercostal space on the left sternal border. Then I'm going to move down to Erb's point, which is in the third intercostal space on the left sternal border. Then I'm going to move to the tricuspid space, which is in the fourth intercostal space on the right sternal border. Then I'm going to go down to your mitral, which is in the fifth intercostal space on the left midclavicular line. Perfect. There's presence of S1 and S2 noted in all 5 cardiac areas. Now I'm going to take your apical pulse for 1 full minute. So your pulse rate apically was 52 beats per minute, which is regular. And then I also counted your respirations while doing that and got 12, which were also regular, and they appeared unlabored. listen to your lung sounds. And if you don't mind turning around. Yep, perfect, thank you. And I'm gonna listen to one inhalation and one exhalation, so one full respiration. So if you could just give me kind of like a breath every time I move my stethoscope. And you could turn back around. Sounds good. Lungs are clear to auscultation anterior, posteriorly, and laterally. Now I want to begin your abdominal inspection, so if you wouldn't mind laying down for me. I'm going to lift up your shirt a little bit here. I'm just going to inspect it first. Looks even, no presence of masses. Now I'm going to auscultate it. Presence of bowel sounds noted in all 4 quadrants. Then I'm going to palpate it. Okay, you can sit back up in the chair. There's no presence of distension or tenderness. Now I'm going to take your pulses bilaterally, and I'm going to start with your wrist. I'm going to just move this up a little bit. Thank you. Okay. Okay. Radial's normal, graded 2+. And I'm going to take your posterior tibial. Both those are bilaterally normal as well, rated as a 2+. Now I'm going to take your dorsalis pedis pulse. Both have normal strength as well, graded as a 2+. I also assessed for the presence of edema while doing the pulses, and there was no edema noted, so there's no presence of varicities. Now I want to begin my range of motion exercises. So you can stay sitting if you mind and crossing your legs. I'm going to ask you to touch your chin to your chest. Okay, you can put it up and now try to tilt your head back as far as it will go. Okay, and now you can swing your chin over your right shoulder for me to the side, and then same thing to the left. Okay, perfect. And now I'm just going to ask you to repeat those, but I'm going to apply some resistance. Okay, now try to put your chin to your... Okay. And do the same thing coming back. Alright, now try to turn to your right. And try to turn to your left. Okay, looks good. And can you shrug your shoulders to your ears? Okay, same thing but with resistance. Alright. And now I'm going to ask you to bring your arms out to the side halfway and then up over your head. Okay, good. And now you can do the same thing but hold your arms out in front of you and lift them halfway, then up over your head. Okay, I'm going to ask you to do the same thing but resistance when you get halfway, and then try to lift up. Okay, and then out front again. Okay, and can you bring your right arm across your body? Yeah, like that. And then you can put it back, and then you can move your left arm and do the same thing. Okay. And now I want you to flex your elbow, so if you want to hold your arm out and then bend your elbow up. Yeah. Yeah, like that. Okay, now I'm going to do it with resistance. So, don't let me straighten your elbow. You can keep it like this. Okay, then you can hold it out straight. Don't let me bend it. Well, can you hold it out straight?
Yeah.
Don't let me bend it. Okay, perfect. Now you can hold both your hands out and now flip them up. Okay, good. Now you can stand up for me. And can you lean forward and touch your toes? Okay, good. You can stand back up and you can lean back as far as you can go now. Okay, looks good. And can you like lean side to side for me now? And then now can you try to touch your heel to your butt, or like high as you can go, like, yep, like that, and then try to bring it forward as far as you can. Yep, now we're going to do it with resistance. Can you kind of turn to this side a little bit? Like that side.
Oh.
Okay, and then you can bring your leg back up like it was, and then try to lower it. Okay, and then go to the front, and then try to put it back down. Now you can sit back down. And you can bring in your feet inward. Yep, and then put them outward. Okay, and I'm going to do the same thing, but I'll put resistance right here. So do it again. And you can bring them outward. Okay, good. So your muscles do full range of motion in upper and lower extremities. And then bilateral equal strength, 5 out of 5. Now I just want to assess your ability to walk with proper balance, so if you don't mind walking for me.
Just over there?
Yeah, just walk. Okay, walk back towards me. Okay, it appears smooth and even. No problems with balance or coordination.